Next, we're going to be talking about the pathway of blood in the brain. So I made this, and this is the circle of Willis, so it's all of the arteries in the brain. And the circle of Willis provides an alternative pathway for blood to flow in the brains. And then I'm going to go over what each of these different pipe cleaners represent. Okay, so this is the circle of Willis I made, and again, it's just providing an alternate pathway for blood to get to the brain. So starting out right here, the blue and the green twisties is the internal carotid artery, and then from there we go up, and the purple right there, that's the anterior communicating artery, which then branches out into the two blue twisties, and that is the anterior cerebral artery, and the anterior cerebral artery is providing blood to the frontal lobe. So we come back down, anterior communicating, right here this pink one is the middle cerebral artery, which then goes to the posterior communicating artery, and then we have right here the red is the posterior cerebral artery, so that's providing blood to the occipital lobe. And then right here, that blue and white twisty, that's the basilar artery, and the basilar artery sits on the surface of the pons, and then from that it branches off into two vertebral arteries, which is the green right there, and these are going to be going through the transverse foramina of the cervical vertebrae. So yeah, this is the circle of Willis. So one disease that might affect my nursing career is an aneurysm in your brain. So with an aneurysm, the arterial wall is getting thinner and weaker, and when this happens, the blood could start pooling into kind of like a balloon shape with the artery, and this can be life-threatening because if it ruptures, that could cause bleeding. And so a lot of times people don't even know that they have an aneurysm until they start having these extreme headaches. So one way to treat an aneurysm is to give them medication to help their blood pressure and prevent it from rupturing, or in some cases you might have to have surgery where they clip the aneurysm. So another type of condition that I might see in my nursing profession is a stroke. So a stroke is because there's an interruption of blood flow to the brain, and this could be because there's a blockage in an artery or a blood vessel ruptured and then it started to leak into surrounding tissues. And so there's a specific window of time that you should try to catch the stroke in order to minimize the amount of damage that it causes. So a person might come into the ER and they might be complaining of a headache, blurry vision, numbness on one side. And so a way you can diagnose a stroke is by having the person speak and they'll jarble up all their words and they'll not be able to form a cohesive sentence. Or you can have them smile and one side will smile and the other side won't be able to. So one way to treat a stroke is by giving them TPA, which is a clot buster, and so it'll basically dissolve the clot and cause blood flow to be restored to the brain. Another condition that I might see in my nursing profession is a subdural hematoma. So a subdural hematoma is when there's bleeding in between the meningeal layers of the dura mater and the arachnoid mater, and this could be because somebody was in a traumatic accident, like a car accident or something like that, or they're elderly, so they're on blood thinners. And so a way to treat these is by either just waiting it out and just seeing if it'll evacuate itself, or sometimes a surgeon might have to perform a craniotomy and evacuate the hematoma. Another condition that I might see in my nursing profession is a TIA, or a transient ischemic attack. So a transient ischemic attack is caused because there's a lack of oxygen and blood flow to the brain, either because one of the carotid arteries is blocked or another type of artery is blocked to the brain. And this is going to cause stroke-like symptoms. A TIA is also known as a mini stroke. So the person still might experience headache, blurry vision, numbness, but instead of a stroke, this one will resolve itself within minutes to hours. But somebody should still seek medical help because you want to make sure that it was a transient ischemic attack versus a full-on stroke. Another condition that I might see in my nursing profession is a liver laceration or liver lac. So a lac means that there was a tear in something. So a liver lac could be because there was some type of blunt force to the abdominal region which caused the liver to tear. And in some cases it could be very mild, or it could be all the way up to severe where they need an exploratory laparotomy in order to stop the bleeding.